There's a quiet shift happening in the world of wearable sciences right now, and some of the most advanced innovations have actually trickled down from our wrist to our fingers. A smartwatch clearly had this moment, but a lot of us quickly got tired of having yet another device that we must charge on a daily basis, having to deal with yet another distracting screen, and dealing with notifications that are constantly buzzing on our wrist all day. A smart ring, on the other hand, is an answer to that fatigue. And the Rincon Gen 3, which I'm wearing right now, is actually one of the most promising takes on the idea of a smart ring that I have tested in the past few years. It's light, it's unobtrusive, and above all, I usually forget it's even resting on my fingers and tracking a whole bunch of body vitals and biomarkers. The Recall Gen 3 covers all the essentials that you would expect from modern smart ring. Continuous heart rate, HRV, blood oxygen saturation levels, skin temperature, and sleep tracking. And all of it is provided to you in such a detailed fashion that you can make use out of it rather than getting overloaded with biosensing information and not knowing what to actually do with it. Recon also leads pretty heavily into sleep apnea detection, and there's also a respiratory health angle that sets this one apart from the competition. So the hardware is pretty impressive, but here's where we need to slow down just a little bit, because a smart ring is only as good as the data that it gives you, and ultimately what you do with that information and make the necessary lifestyle changes and seek interventions from an expert. And this is where a lot of people, me included, start to have questions. The first one is going to be about accuracy. The ring on your finger isn't actually a medical grade device, and it's easy to treat every number that it gives you as a gospel. Second, we have to talk about the anxiety problem, because when you are tracking your body 24/7, it's surprisingly easy to spiral over a single bad night's sleep data or just one elevated heart rate reading. And third, and this is going to be the big one, is what do we actually do with all the data? What does it actually mean? And what you are actually supposed to do with all the numbers that you are seeing in the connected app or software. So, the honest answer is that these devices work best as a tool for spotting trends. These are not intended to diagnose problems. In order to understand the true potential of smart rings, the best practices, and the risks that they come with, I talked to multiple experts. The first one is Dr. Seth Martin. He's a professor of medicine in the Division of Cardiology at Johns Hopkins, where he directs the Advanced Lipid Disorders Program and the Digital Health Innovation Lab. He also has expertise at the intersection of preventive cardiology and digital health, which is exactly the field where a device like the Rincon Gen 3 Smart Ring lives.
It has been an impressive, miniaturization of clinically relevant sensors like PPG that allow for heart rate detection. I do think that when it comes to specific clinically relevant or health-related signals, heart rate can be well measured by wearables, including wrist-worn as well as the smart rings. So by being able to measure heart rate, it has multiple, potential clinical applications. Number one is around heart rhythm, because a fast heart rate or an irregular heart rate can help you detect atrial fibrillation. It also can be quite relevant to programs like cardiac rehabilitation. That's an area that we've been particularly interested in, because it's a type of program that can benefit patients tremendously, but is highly underutilized. And so if we can deliver cardiac rehab through more flexible home-based setups for patients, then that could do a lot of good.
I currently have a smart ring. It's the Rincon Gen 3. It is one of the first smart rings out there that actually has a haptic feedback system. So instead of the user having to go to their phone to see the notification, what happens is you get a vibration alert on the ring.
Things like a haptic signal to remind someone of an important health behavior. I'm supportive of that. There's not a question of accuracy, right? It's like you personally set a signal when it's helpful to you. And I think that that makes a lot of sense. So I shared a couple examples where I think the data are generally reliable with heart rate and sleep. But an example of where we need to be very cautious is blood pressure. The cuffless approaches to blood pressure assessment are not ready for prime time in the sense of being able to give specific numbers, with the idea of using the wearable data not to give an exact blood pressure measurement, but to be able to identify people who appear to be more likely to have high blood pressure that then could be measured with a medical grade device. I think that's a good thing if the wearable prompts that attention.
How far do you think metrics like these, like not just taking a look at the heart rate numbers, but also your respiration and the broad spikes in blood pressure and spikes that are measured while you are sleeping? Do you think these can play a holistic role into telling a person about how their heart health or overall health is? And if all of this is coalesced and combined into a smart ring form factor, do you think this is a step in the right direction without overhyping or overselling it?
If the data in total, like somebody that could have abnormal signals during sleep would be, for example, somebody who has a diagnosis of sleep apnea. And I would say if the totality of the signal from the wearable leads to concern for sleep apnea, and then someone actually goes and gets um, a formal evaluation for sleep apnea and receives that diagnosis and gets treatment for that, I could see how the data could be used for um, uh, to facilitate medical care. Ultimately, the benefits are going to be the way that those signals are tied to healthy actions.
So, we have got a brief understanding of how wearables can help us better understand our health, but is the data enough? So, I spoke with Dr. Deborah Rozman about stress recovery and why awareness only matters if it leads to some meaningful action. As a president and co-CEO of HeartMath, she has spent years researching the physiology of stress, how the heart and our brain communicate, and she has helped develop a heart rate variability biofeedback system that is now trusted by esteemed institutions such as Stanford Medicine, all four branches of the US military, the NFL, and the MLB. Which is the more important factor, like getting the data or taking actions on the insights provided by the variable and the algorithm? Like, how do you see this equation going?
Yeah, the 2 together are optimal. Tracking, getting the data, and that helps you really use the heart math techniques or other methods that get you back in center, back in sync, that release stress. Having both, we find that people are more motivated to do what they need to do to improve their health if they have the HRV biofeedback and see what's going on in their system. And so that's the optimal, is tracking, it's getting the data and then knowing what to do with it. But again, action on it is more important than the number.
The ring that I am wearing right now, it is it has been validated to have an accuracy of over 98% at measuring the heart rate. And at measuring the heart rate variability, it has a mean absolute error rate of less than 3.5 millisecond, right? So where do you set the baseline of accuracy for heart rate measurement and heart rate variability measurement?
It depends what you're trying to measure. It depends on how, like, if you're a doctor or a health professional, you want the highest accuracy possible. And you can go online to compare these different devices and see which has what accuracy. I mean, people do that all the time. But each type of device, whether it's a ring, a sleep, it's measuring blood pressure, whatever it's measuring, it's going to have different degrees of accuracy or thresholds. And you have to, it depends on what you're looking for, look online to see and what it's measuring and what the gold standard is.
When you have a like biosensing device on your body and it's measuring a whole plethora of biomarkers, so how do you think like a variable that can also measure heart rate variability, heart rate, SpO2 levels, as well as spikes in your blood pressure levels, can they realistically or scientifically all this information tie into creating a more holistic and a more realistic picture of whether your vascular health trends are okay?
It would make sense if the more biomarkers you have, the more information you have, and there are correlations. Most consumers have no idea how to interpret all that. It can be overwhelming, like, oh, should I be scared to go see a doctor? What does this mean? And the websites of these devices attempt to help people understand. You really need to understand what you're trying to measure.
So we're seeing an increasingly high number of companies that are now building AI assistant into their companion apps for wearable devices. The smart ring that I'm wearing, the companion app also has an AI health assistant, and these assistants have been designed to help you make sense of all the data that is being collected by these sensors, right? So, do you think like this is a right approach? Because as you mentioned, an average person would find it very hard to make sense of all the numbers that they're seeing on their health dashboard, right?
And I think that it's going to be needed to make sense of all that data. I think it's a wonderful use case, but you can't 100% rely on it yet because of it's still not advanced enough to be completely accurate. So it's a signal. It's giving you advice. It's better than you trying to interpret it all yourself because you don't know. So take the AI health coach or assistant and see what it says and check it out with yourself. Does it feel right? Does it make sense? If there's a warning sign, go to your doctor and really get it checked out. I think it's incredibly valuable, but it still comes back to how you feel. It comes back to how coherent are you? How in charge of yourself? How nervous system regulated are you? Or how dysregulated are you? That's the ultimate checkout.
So we have established how wearables can act as a very meaningful kind of intervention and give us the data and the signals to adopt healthy lifestyle habits and seek expert help wherever it is necessary. But there's also one more dimension to all of it. What happens when a wearable grows beyond a wellness gadget and starts playing a more meaningful role into how we care about our bodies? To understand that, I spoke with Dr. Sanjeev Sharma, who is Chief Medical Officer at Upright Science. He has spent nearly 2 decades practicing emergency medicine before founding Highmark, which is a company behind an FDA cleared software as a medical device balance technology. He has seen both sides of the line, the clinical reality and the consumer hype around wearables. And he has some grounded perspective on where these devices help and where they can mislead an average person who is enthusiastic about using wearables to take care of their health.
What we've seen is an explosion in wearables, different devices to gather information. Um, and the challenge in the consumer has, and the regulators, the FDA, is how do you get good information that you can act on versus noise?
How do you think an average person should approach a wearable device, especially one that comes in the form of a smart ring, and how they can align that expectation based on what these wearables and the sensors are currently able to accomplish?
We know that anytime a patient is more engaged in their healthcare, they tend to do better. So the wearables inherently help with that because they give you feedback. Um, then it comes down to what kind of information do you want as far as how do you want to improve your health. So if you have cardiac issues, you can do some research and look at which wearables are cardiac centric.
How do you see this intersection of biosensing data being collected by a smartwatch sensor and it is tying into a much broader picture than just getting, your resting or active heart rate?
I think the industry will continue to evolve. I expect some of the leading firms to continue to do research that demonstrates their effectiveness. Um, there's one ring in particular that uses an accelerometer and infrared sensors to get a better understanding of skin temperature, blood flow, movement at sleep. And so I think in the next 12 to 24 months, we'll see some of these companies putting out what I call validation studies. So they compare themselves to the gold standard. And that's one thing that consumer can do, to say, what is the gold standard for medical testing in my condition? And then how close is the wearable that I'm looking at doing to that gold standard?
Why should someone buy a smart ring? Like, what benefits can they get from it, or why they should avoid it? Like, what's your take on this form factor in specific?
I think look at what health condition you have, and then look for, is there a wearable that has that? And if not, which wearable? I mean, the ring is very easy. It's easy to use. It's also has an aesthetic appeal to it. Which ring doesn't have a complaint lodged against it, and which one has the most studies that have been done? And the studies are combination of validation studies, so compared to the gold standard, and peer-reviewed studies. And I think if company has that, it's not a bad idea to make that investment as a consumer and say, I'm going to be focused on this condition.
So, as verbal continue to evolve, the real value may not be in collecting more and more data, but in helping us better understand what these patterns actually mean and how they can shape our everyday health, whether it's sleep, stress, recovery, or daily habits. The ultimate goal remains the same: turning awareness into action. And this is where a device like the Rincon Gen 3 Smart Ring can come in handy. And that brings us to the end of our discussion about the smart rings and how they can prove to be a meaningful intervention and a lifestyle partner in your health journey. I'm Nadine from These Trends. Thanks for watching.